Hello, thank you very much for the invitation. I shall be talking about the use of the intuitive colorimeter in neurological disorders. The intuitive colorimeter is simply a box that illuminates text with coloured light. We have a special method of choosing a colour that's optimal for looking at text, in which the hue and saturation are varied independently at constant brightness. The patient has the chance to select exactly the chromaticity that he is most comfortable with. Having obtained that chromaticity, this is replicated in tinted trial lenses, which are combined just 2 dyes at a time to provide exactly the appropriate colour under normal white illumination. The combination of tinted trial lenses is then used as a prescription for applying dye to spectacle lenses. I shall begin with a declaration. Although I invented the intuitive colorimeter and precision tints, and the MRC gave me an award to inventors, the bottom line is that I no longer receive money from this invention. The extraordinary thing is that if you give a patient who has symptoms that remit with the appropriate colour, that colour is very specific. We demonstrated this in the study shown here, where 2 examiners examined a patient, one after the other, and they were different examiners, different colorimeters, and yet the average difference in chromaticity from one setting to the next was 0.043, which is about the size of this small line in the CIE-UCS space. This system has been in clinical use for some 20 years in Britain, and in the first 1,000 tints are shown here. Greens and blues are the most common, but all available chromaticities are sometimes used. I need to introduce you to the Wilkins rate of reading test. This is a very simple reading test, but it shows the effects of colour extremely well. The test is simply made up of randomly ordered high-frequency words. Same 15 words on each line, but in a different random order. And the patient is required to read aloud as quickly as he can. The test has been shown to have very high precision and high reliability. And a difference of 15% in reading speed, or 7.2 words per minute, is outside the normal limits. So it indicates an effect of an intervention such as colour on reading speed. Now I'm going to talk about a variety of neurological disorders: photosensitive epilepsy, autism, migraine, cluster headache, stroke, and head injury. I'll begin with photosensitive epilepsy. This is usually diagnosed with the help of the EEG, in which electrodes are collected to the scalp, and the small difference in electric potential between the electrodes is measured. The patient is exposed to flicker from a bright flickering light, and the EEG then sometimes shows what is known as a photoparoxysmal response. The colour of the photoparoxysmal response has been investigated in a large number of studies, one way and another. Those that are green show that the glasses have an effect on the likelihood of a photoparoxysmal response. those in red show it has no consistent effect. The most recent studies have shown an effect of a strong blue tint which absorbs long wavelength light in reducing the photoparoxysmal response. But this is hardly surprising, given that the tint only transmits about 6% of the light, and it's strongly coloured, so it's not suitable for everyday wear. And patients are sensitive to patterns as well. We undertook a study of using the intuitive colorimeter some time ago now. These are the chromaticity of the lenses that the patient selected. The large points represent the settings from patients who did particularly well with them. We had 33 patients with photosensitive epilepsy. 23 reported beneficial perceptual effects of coloured light and were given precision tints to wear. 17 of the 23 were available after 2.4 years, and 76% of those were still wearing the glasses and reporting reduced symptoms. It was difficult to tell whether the seizures were reduced because of changes in medication, except in one case where the reduction was unequivocal. There had been no change in therapy throughout this time, apart from the introduction of coloured glasses. And you can see that the incidence of seizures is very greatly reduced by these bluish lenses. Now autism. Most of the work has been done by my colleague and collaborator Amanda Ludlow. In her PhD, she looked at the effects of coloured overlays, these are sheets of coloured plastic you place on a page, on the rate of reading. She found that the chosen colour could improve the rate of reading in by more than 15% in 11 out of 19 children with ASD, but only 1 out of 19 typically developing controls. In 2008, she compared the overlay chosen for clarity with the overlay chosen for preference by just asking children to choose the colour they liked best when it was placed over a white sheet of paper, as compared to the colour that was best for clarity when the overlay was placed over a page of text. And she found it was the overlay chosen for clarity that improved the reading speed. She also showed that it wasn't just reading speed that improved, but matching to sample in this test here, where you have to match the object on the left with one of those on the right. Then she reported a case study of a 13-year-old boy diagnosed at age 4 with ASD and ADHD. He reported hot eyes in response to bright colours, leading to a headache and nausea. She had a strong obsession for blue and purple and a good response from a purple overlay. And then the intuitive colorimeter in blue lenses. The lenses have a transmission shown here, and the effect of the lenses was dramatic. The period of when the lenses were worn is shown by the grey bars. They were broken for a brief period, as you can see by the separation of the bars. The vomiting was eliminated. The burnout was eliminated, but it returned when the glasses were broken. The periods of hot eyes were reduced, and gratifyingly, there was an increase in social activities as a result of the lenses. Then Amanda Ludlow looked at the mind in the eye task of Baron Cohen and showed that the appropriately coloured overlay improved performance on that task. The person has to register the most appropriate emotion that's being expressed by the eyes. Finally, my colleague Lydia Whitaker did a study in which she had a two alternative forced choice between two faces, and the person had to determine which of the faces expressed the stronger emotion. That's a holistic task. You can't do it by looking at just the eyes or just the mouth. You have to examine the whole face. And the children were better, the children with autism were better when the screen was tinted the same colour as that they'd chosen earlier for reading. And now in 2020, Amanda did a lovely study in which she used the emotion evaluation task. This is a task in which there are 28 videotaped vignettes of professional actors enacting ambiguous scripts representing 7 basic emotions: happy, surprised, sad, angry, anxious, revolted, and neutral. The stimuli are dynamic and they're portrayed in naturalistic, complex expressions, and they're provided with intonation and gestural cues. So these are colour videos that the patient has to watch and then decide upon. Amanda used the intuitive colorimeter to select an optimal colour, which is shown by the small circles in the two graphs, and then a computer to select a suboptimal colour, that's shown by the other end of the lines in these graphs. The top graph is for the children with ASD, and the lower graph, the control children with typically developing. Then a month after she'd found the optimal tint, she undertook the emotion evaluation test. The children wore the tint while they were looking at the computer screen, and you can see that the chosen tint has an effect on the children with ASD. It improves their performance up to normal levels, whereas there's no effect on the typically developing children. Now, migraine. There is a huge presence of migraine and tints on the web. But does that actually mean anything? Well, in a recent study, we've looked at we've asked people who have migraine and those who don't to find a colour that's comfortable for reading in the intuitive colorimeter. And what we found is that most people who are asymptomatic, who don't have headaches, tend to choose colours lying along this line. This line is the Planckian locus, and it represents the colours that are available from typical lighting, including daylight. So incandescent lighting is fairly yellow, daylighting is fairly blue, and the colours lie along this line. And those are the colours, by and large, that people choose as comfortable for reading. Some people choose a yellowy colour, some people choose a bluey colour, but they lie close to this line. That's not true of people who have migraine with aura. You can see their choices are quite strongly saturated, well away from the Planckian locus. People who have migraine without aura are rather close to those who are controls. Does it make a difference? Yes, we provided a tint for them to use while they performed this visual search task. They had to find the word new in this array of letters, and in case you can't find it, it's there. They had to touch the screen, and the length of time they took to do so was recorded. And you can see that people who had migraine with aura performed about 40% more quickly with their tint than without it, whereas there was no difference for migraine without aura and no difference for controls. Does that mean that tints are actually a useful treatment? Well, we examined this question a long time ago, and we didn't find very much, to be honest. Here is the optimal colour. Here is the control colour connected by a line. Different patients chose different optima and different controls. The controls were selected by computer. This is the proportion of days when the active lenses are worn, proportion of days when the control lenses were worn, and all the points in this part of the diagram, the green part, are patients who did better, had fewer headaches with their lenses. And there are slightly more points that side of the diagonal, but we're going to have to do better than that. We're going to have to discover how best to identify those individuals with migraine who are going to benefit from treatment. Now, cluster headache. This is a single case study that I want to report. This university colleague diagnosed at the National Hospital, Queen Square in London. He wore his tints when his prodrome occurred, and the prodrome didn't progress to headache. He found that instead of progressing to the cluster headaches, the prodrome evaporated. This was the tint that he chose. It's greenish, and he's been free of cluster for 5-6 years now. Doesn't use his injections or his oxygen that were provided by the National Hospital. So it's not just one patient, though. It looks, I now have 2 patients. The second one is undergoing trials at the moment, and this is his report. I'm using my new tinted lenses regularly and can report that they seem to be helping when prodromes begin. However, my severe cluster headache cycle starts in earnest around Christmas time, so I will be able to report back in due course whether they are effective in preventing the full cycle from commencing. Well, all I can say is good luck to the patient, and I hope it does prove to be beneficial for him. Now, stroke. There are 3 studies here done by Ian Beasley and Leon Davies at Aston University. The first study showed small effects on reading speed and accuracy of coloured filters following stroke, and effects on visual search of filters in stroke patients. And then one case study where a lady had a stroke, found the coloured glasses very useful for reading, and subsequently, unfortunately, had another stroke, and her colour prescription changed. She was then able to read, but with a revised prescription of colour. Now, head injury. There have been several studies here. This is one showing a wide range of different colours as mitigating photophobic symptoms in post-traumatic head injury. Here's a second study in which the intuitive colorimeter was used, but there was no effect on reading speed, but they used, they looked at the speed of reading prose rather than the rate of reading test. And then I'd want to report unpublished work by Karen Monet and her team at Opticam in Ottawa. They used the intuitive colorimeter in clients with acquired brain injury. And between September 2013 and July 2021, their team have seen 112 males and 253 females, average age 40. They're seen on average 2 years after injury, but with a big range, and they're referred by optometrists, occupational therapists, physiotherapists, by word of mouth, family doctor, and so on. It's a big range of referrals. The complaints are fairly standard. Most patients suffer light sensitivity, most have headache, and a substantial proportion have reading difficulty. Now, Karen has found that with the intuitive colorimeter system, it's helpful to add grey lenses because the patients are so photophobic. Normally, one would just use two coloured dyes to get the range of colours shown in the appropriate part of the CIE diagram, but she adds, in addition, a grey to bring the light level down and improve their photophobia. Now, this is the range of chromatistes that she's found. It's rather similar to those of the first 1,000 tints. Bluish is a common colour, so is greenish. The average transmission is 39%, so they're quite wearable. And the grey dye is included in 51% of prescriptions. She's found that this prescription improves the rate of reading in 29%, by 29% in speed, and 170 clients have increased the reading speed by more than 15%. So there's a substantial effect on rate of reading. Interestingly, she's seen 88 clients twice, with an average separation between the two appointments of 1.2 years. The chromaticity difference between the two exams is exceedingly small, 0.043, whereas there's a greater transmission on the second exam, and that's because there's less grey dye necessary. She's seen 18 clients 3 times, with a fair separation of at least 4 months between each appointment. And again, the average chromaticity difference is exceedingly small, but there's a progressive increase in transmission from one appointment to the next. In fact, the similarity in chromaticities from one exam to the next is similar to that you get when the two exams are immediately one after the other, as I showed earlier. So in patients with head injury then, the chromaticity of the tint is stable over time, but the transmission increases because the grey dye is reduced, and there's a substantial benefit in reading rate. I've shown you the possible benefits of tints in 6 neurological disorders: photosensitive epilepsy, autism, migraine with aura, cluster headache, stroke and head injury. But there are 2 other conditions that may also benefit, but where the evidence is very small at present. First of these is Tourette's, where Amanda Ludlow has looked at children with Tourette's using coloured overlays in one study. And finally, multiple sclerosis, where a colleague of mine has done one study reported in neurology of overlays. Now, most of these disorders are comorbid with epilepsy, so that would be consistent with a hyperexcitable cortex, and perhaps what's happening is the tint is redistributing the activity within the cortex, avoiding hyperexcitable regions. That's a working hypothesis, but it's only that. But it does look as though we have a new field, which we might call neurooptometry, in which neurological conditions can very often be alleviated with the help of precision tints. Thank you.